Hi guys, here I am again. I just came back from New York from Memorial Sloan Kettering, had my consultation with my doctor, and basically a lung biopsy consists of me being put to sleep under some anesthesia, a little Valium and morphine, so I'm gonna be high as heck. They do use a needle. I'm gonna be face down, so they're gonna go in through the back. The biggest concerns are that I can cause some bleeding because, you know, the lungs consist of a lot of vessels in your body. Also, infections and the possibility of my lungs collapsing. Now, all of that sounds very scary, but after speaking with the doctor today, I'm not scared at all. He's experienced, he's been doing it for 30 years, and you know, if my lungs do collapse, it is not a life-threatening situation. I would have to stay in a hospital. This is a one-day procedure, but if the lungs collapse, I would have to stay. And they just pump it back up, according to the doctors. They pump it up and they monitor you, and you go home from there. They are only going to do the biopsy on the tumor in my left lung, so that's good. I thought they had to go, you know, on both sides, my right and my left. But just the left lung. I'm trying to remember everything. I'm trying to give you this news while, you know, it's raw in my mind. They did a little blood work today, hence the big old band around my arm. And that's just to make sure, you know, my blood counts and all that is good for the procedure. Now, the procedure is on Thursday. And again, I'm not afraid. You know, there won't be any type of like scars or, you know, pain associated with it. You know, the biggest thing I was concerned about was, you know, whenever you touch a tumor, like a cancer tumor, the possibility of, you know, bothering it to make it grow is always something that can happen. So, you know, one of my questions were, will it affect, you know, the tumor in any way? And the answer to that is yes. Sometimes it happens and sometimes it don't. It is something that a patient needs to really just weigh out their options. Like, you know, is it that important to have the biopsy? Because that is a possibility if you do have a biopsy done. And that's just with anything, with any surgery that's dealing with cancer anywhere. You do risk the tumor growing or, you know, spreading if it is touched. So here we are. Just to update you, yes, I am going the natural route, but I am still going to different hospitals to find out if there's any other treatments. You know, I am very sure that I am not doing chemo again. But unfortunately, I do have to allow them to do biopsies and things like that to see if there's any other type of treatment that they can give me. You know, I'm refusing chemotherapy, but if there's another treatment, like just for an example, like immune therapy, which helps your cells fight back the cancer cells, I'm really open to other things. I'm just not open to doing chemotherapy again. So overall, today was a good visit. I got all my questions answered, and I felt very comfortable with the doctor. The energy between the doctor and I was positive. I felt positive energy with the doctor. So I guess it's on and popping. Thursday morning, I will be undergoing the lung biopsy procedure. Like I said before, they're going to put me to sleep. I'll be there practically all day, but I'm sure I'm going to wake up and give you guys an update the minute I'm feeling up to it. And again, please feel free to ask me questions. I do want to acknowledge everyone who has commented on my first video. Thank you so much for your support and for your love. I appreciate it. And, you know, if you have any questions about anything, Don't be afraid to ask me. I'm willing to be open and honest and vulnerable, completely open and vulnerable to all of my watchers. So there's your update, and I hopefully will see you guys again on Thursday. Take care. Bye-bye.